And this is Last Chance Surgery. Tonight, baby William has survived a life-saving heart operation.
It's a big thing for somebody who's only 12 days old.
But his biggest battle is still ahead. Without surgery, Merryl had just 6 months to live.
Things aren't looking very good for you, I'm sorry.
The operation is over, but has it worked? And has Merryl been given more time?
I think I got at least 90% of it out.
And Shirley's simple wish to walk normally.
Just to have a leg, it'll just be fantastic.
In an Australian first, the high-tech operation to give Shirley a computerised leg.
I'm high, mate. I really am.
The parents of baby William have had a nervous wait. At just over a week old, he has endured last chance surgery, an open heart operation for a rare and dangerous condition. All of William's pulmonary veins were attached to the wrong side of the heart, so Professor David Winlaw had to rework the plumbing, reattaching the veins to the correct side. And to do that, he needed to stop baby William's heart.
Okay, Hayden, let's come on bypass, thanks.
Then he could repair William's heart, saving his life. His parents were relieved to hear all had gone well.
Yeah, I mean, we got the best possible news, so we're so happy.
But the first 24 hours are crucial. And one day after the operation, they are keen to hear from Professor David Winlaw how their little boy is faring.
Good morning.
Morning. Morning.
How are you both?
Pretty good.
Pretty good.
We've had a pretty stable night, as I'm sure you've heard. And what we're happy with is that his blood pressure has been good and his pressures in his lungs have been good. No, he's completely unaware at the moment. In addition to not being able to move, he has no perception or no awareness. But all of those drugs will be reduced today. It's good to have a bit of a rest to begin with after an operation like that. We'll see you later. Bye.
It's more good news. The next milestone they're hoping to achieve is having their only child breathe on his own. Life's pretty hard for country mum Shirley. The only way she can get around is in a wheelchair or on crutches. 4 years ago, Shirley's right leg was amputated above the knee.
Was going down to have a knee replacement. I unfortunately ended up with an infection and they just couldn't cure it.
Shirley has tried prosthetic limbs over and over again, more than half a dozen, but none would work for her.
See, you go and you're rubbing all the time. It is awkward. It's really bad up here when it twists. It's not a good feeling at all.
And on one occasion, the prosthetic gave way and Shirley fell and broke her other leg.
You go to try to make a bed, you can't do it. To put clothes away, you can't because they're up higher and, you know, it's just simple things you think, oh, you know, anybody can do it, but you can't.
We got those latest x-rays?
But there is a doctor who can change Shirley's life.
She was sent to me as a sort of a last resort because of the weird surgery that I do.
Professor Ian Woodgate was the surgeon who had to amputate Shirley's leg. He's also the surgeon with the ability to give Shirley a new limb with a revolutionary procedure, a first for Australia.
So stage one of this device, which is new to Australia and the Southern Hemisphere for that matter, is the insertion of a rod so that we get inside the bone of the femur in this situation so that we don't have to rely on any prosthetic devices on the outside. So essentially it's just a long rod which is machined into the end of what, in this situation, an artificial bone, but in Shirley will be her own bone. We machine it out. It then fixes into the bone. In stage two, we'll take out the little end cap, which is currently protecting the end here, and then a rod is inserted into the gap that's been protected by the initial fixation screw. And then ultimately this metal post will allow fixation of our whiz-bang, if you like, mechanical leg.
Look, I haven't got anything on. I'm
Yeah,
just going to compare here.
Well, this unfortunately is the other side, but
Yeah,
we've
no.
got the correct side one.
So what are you actually...
So we'll cut through your old wound. We have, we're sort of fixed by that.
Yeah.
But this won't change an awful lot. Obviously, we're going to smooth it out a little bit more. But in the first instance, all you're going to see is me reopening the scar and then closing up the scar, because at the moment we have to let the bone bond without any risk of anything coming in from the outside. So I'll have a rubber cap buried deep under your muscle, just in there like that. So the shape of this won't change an awful lot. You'll be up in a day or two.
Oh, gee, that's fantastic.
Oh, I think it'll feel different for a while. I mean, you've been walking on a prosthetic limb to some extent, but it's not. It does take some getting used to, because you've got to send new messages back to the brain to work out what's this limb doing.
Look, just to have a leg, it'll just be fantastic.
Yeah. I think it's going to give her a new lease of life. She's going to get out of the wheelchair she's unfortunately had to get into because she's had such troubles fitting a prosthetic, and hopefully will become an independent community member. It'll take a lot of pressure off her husband, who is just the most wonderful person, who's been looking after her all this time and doing so much for her, and it'll let them, both of them, enjoy life again.
Merryl is a grandmother who was desperate to spend more time with her family. She had been given 6 months to live. Merryl had a tumour known as a chordoma. It grows out of the base of the skull and into the brain. The tumour has already affected much of what Merryl can do. She has a tracheostomy to help her breathe, and she can't talk. But she wanted a longer life, and her only hope was an operation from neurosurgeon Dr. Charlie Teo.
We're just going to have a look around now to make sure there's no tumour left behind.
The surgery is now over.
Merryl! Merryl, wake up! Squeeze my fingers! That's a girl.
And Merryl has passed Dr. Teo's first test. She can respond to his questions. 12 hours later, and Dr. Teo is back to check on his patient.
Hello.
Good afternoon.
Hans, how are you?
You're doing good, thanks.
Good to see you. Hello. Oh. Well, how are you? You feeling okay? Oh, good. Surgery went very, very well. You may not recall me speaking to you yesterday, but I'm very happy with the way things have gone. We've already done a post-op CT scan that shows that all the tumour's gone. We can't see any left at all.
She's pretty good before she started.
And things are looking good.
Yeah,
things are looking good.
That's the one.
So the chest is good, no fever, no sign of infection. A scan that shows that most of the tumour's gone, if not all of it. Merryl, how good is that?
Yeah.
Good girl. Okay.
That was the one. That's it. Waiting for that, nearly 12 hours, I think it was, that we to wait and get the good news that, yes, everything went well, 90% to 95 now. He says he might have got the whole lot. Isn't that brilliant? Eh? Don't you reckon that's terrific? Eh?
Right, so listen, Hans, you have to be cruel to be kind now. For the next few days,
Kind?
cruel to be kind. I want her sitting in a chair, I want you to push her, I want her breathing up, filling up her chest.
Yep.
And, so we really have to try and push her along now and not to lie in bed. If she lies in bed, she's going to get complications. Yeah.
Right.
Merryl, we'll see you later on. Okay.
I'll look after her, okay?
Okay, thanks.
See you later. Bye.
It's all good news for now. And in the days ahead, Merryl will know for sure how much longer the surgery has given her to live. It's been 5 days since William's life-saving surgery.
It's okay, honey. It's okay. Mommy's here. Daddy's here too.
Doctors had to stop his little heart so they could move the veins that were taking blood to the wrong side of his heart. And the news on his recovery is the best his parents could hope for. William is doing so well, the next stage will be to take the tube out of his nose and let him breathe for himself.
We've been very pleased with his progress so
Yes.
far. He's just waking up from all those medicines that have kept him comfortable while he's been on the ventilator. Once he's successfully extubated, then all these little extra lines, so the arterial line will come out, the one that's measuring his CVP in his neck will come out, and so everything now is moving towards sort of, as we say in the trade, getting rid of the hardware.
Right.
So getting rid of all the tubes and the pacing wires. And he's got 2 little pacing wires. They'll be the last to come out. And once we know he's been stable, and then you'll move to the post-operative ward. You slowly taking over the care and doing more and more of his cares, and we'll be doing less and less. And that's sort of the pattern that we'd like to try and work through.
We get to cuddle today.
Cuddles are important.
Yeah, lots of cuddles.
And that first cuddle is a priority once the tube is taken out.
I was feeling pretty desperate to hold him again. And I'm really looking forward to him not having anything connected to him. And, you know, just the normal, I guess more of a normal routine where actually just really just being with him and being his mum and dad.
A simple request that may still be a few days away. Shirley had her right leg amputated above the knee 4 years ago. Today, she is on her way to the operating theatre to be the first person in Australia to have a revolutionary artificial limb attached.
Yeah, it's the first one of this operation being done in the Southern Hemisphere, so that sort of makes it significant straight away. This is a relatively new technology to us, you know, down in the Southern Hemisphere. It's going to make a huge difference to her life. This lady had 9 operations before I even met her. No, I was thinking just on this leg. Total knee, revision, total knee, revision, total knee, revision, total knee, revision, total knee. Is that up to 9 yet?
Not quite.
A lot.
Another couple.
What we're just trying to do here is raise our skin flaps. Tedious, this part of the operation. So we're just going to strip up the muscles till we get to the area where we're going to do our bony resection. So we've got the end of the bone exposed here, ready to go.
Once the bone is exposed, Professor Woodgate will make a canal in the bone. He will then insert a metal rod that will, over time, bond with Shirley's own bone.
So the next thing we're going to do our preparation of the femoral canal. So this is just a machining tool to open up the canal. This is a flexible reamer, so this will just open up the canal ready for us to prepare the bone for that rod. Starts to look a bit like a Meccano set, doesn't it? So we've just finished preparing the bone. We've just slightly under-reamed it so when we put the stem in, it gets a really tight fit. So this is that rough coating that we saw the other day. It's going to get the bite onto her bone. It's just got this little taper out. This is going to be tight. Just let that settle a little bit. I dare you to try and pull that out. So this just goes in the end to protect our taper, so it's just going to screw in the end temporarily, and that'll be coming out when we do stage 2. Well, in the next sort of 6 to 8 weeks or so, that bone's going to grow into that rough coating that we saw on that implant, which will make this completely solid. It'll also seal it off potentially for the future. That is, infection then can't get round and into the bone cavity.
That's all Professor Woodgate can do for now. Shirley will be back in 8 weeks for what she's longed for, her last chance to walk again. It's been 9 days since Merryl had an operation to remove a tumour in her brain that was killing her. She has a little double vision, and because she has a tracheostomy to help her breathe, she is still communicating with her sketch pad. And now her neurosurgeon, Dr. Charlie Teo, is back to do some quick tests to see if Merryl's recovery is still going well.
Can I just have a look and see how that arm's going there, Merryl? Can you clench your fingers? Oh, yes. Yes, yes, yes. A bit harder? Yeah. Make a fist. Oh, good girl. Oh, good girl. That's better. Okay, well, that's going to come good. It's going to be slow, but it's going to come good. I think it's great. Yeah. I mean, really, this was high-risk surgery. She could have easily died. She could have easily got multiple complications.
Initially, Merryl had just 6 months to live. But her question now is how much time the operation has bought her.
Essentially, the tumour is out. I think you've got, a long time now. I don't know how long, but I think we're talking years before it comes back again. I think we've given her not only a last chance of life, but I think there's a very good chance she's going to live for many years, given this degree of resection. No, it's a pleasure. It's a pleasure. Yeah. Okay. Okay then, good. She is very sick, but you saw her attitude. It is phenomenal. She has really grasped life and will not let go. Okay.
It's now been 5 months since Merryl's operation, and she's making the most of every extra day the surgery with Dr. Teo gave her.
It's a bad thing to say that it takes something like a brain tumour to make a family get closer together, but I think that's what happened. Mum always wanted us to call all the time, but we always used to say that, oh, you don't have time, but these days you make a lot more time for your mum.
She's always got some cheeky remarks.
Yeah.
About something.
She'll still nag us sometimes as well. That doesn't change.
She's not happy with my hairdo or something. She'll let me know.
I think the best part of it, well, she's still here, aren't you, Mal? Yeah.
Merryl was told she had just 6 months to live. Now she's looking forward to the next 5 years. It's been 9 days since William had open-heart surgery that saved his life.
William, before his operation, he looked okay, but he wasn't okay. And within weeks to months, he was going to suffer some very big problem that may have led to him dying within weeks to months.
But his parents can now put all that behind them. It's time to take their baby home.
So do you have any concerns or problems?
Actually, his feet were a little bit blue this morning. Is that normal?
Okay, let me guess, was he crying a lot at the time?
Yeah.
Yeah.
Okay.
I think that's one of your challenges now, knowing when he's just being a normal baby and when he's just misbehaving as part of that, versus actually having a problem. The kind of things we need to watch out for, if there is a problem, is if he's not feeding, if he's not putting on weight, and if he just seems distressed most of the time instead of like normal babies who are distressed some of the time. It is a short time since his operation, but the great thing about babies is if everything's right with the plumbing, then their normal healing capacity means that they're up and out of here pretty quickly. Well, I'm not going to insist on a cuddle today, but maybe when I see you in a couple of weeks.
Yeah.
He's looking really lovely. Okay, so you know where to find us?
Yeah.
And they're going to go back to Canberra today and start what is a normal baby life and hopefully grow up to be a fit young man.
And that is exactly what William's mum and dad had been hoping for.
Oh, it feels great. Yeah, we're so excited. Yeah, he's 3 weeks old today, you know. He's so good to take him home finally and take him home well.
Shirley had her leg amputated 4 years ago, and since then had dreamed of having a limb that was part of her own body.
Just to have a leg, it'll just be fantastic.
Yeah.
It seemed a far-fetched wish until Professor Ian Woodgate told her he had a solution. A state-of-the-art computerised leg integrated into Shirley's own anatomy. 8 weeks ago, he completed the first stage of the operation to grant Shirley's wish. Now Shirley is back for stage 2 and you can't miss the smile.
I'm getting excited. I'm ready to go. Let me go, mate. No, I'm going. I don't know whether I'll be like that when I come back, but I'm high, mate. I really am. I don't know whether it's just adrenaline's just going through me.
So it's a very pleasing time for her. It's been a long haul trying to get something that really works for her, and hopefully will therefore then work for a whole lot of other people who haven't been aware of this thing being around.
Shirley's chance to walk normally again is just minutes away. The second stage of the operation to give Shirley a new leg is about to begin. 8 weeks ago, Professor Ian Woodgate inserted a rod into the bone in Shirley's leg. That has now firmly bonded, and they can expose the end of the rod. Her new computerised leg will attach to that rod, giving Shirley a leg that is part of her own body.
So we're going to insert a rod in through the skin, see if we can get into the middle of our rod. Shoot that. Yeah, good. So there's our rod going through the skin, through the fat, through the little muscle over the end of the stump, and it's hitting into the centre of the canal of our little protection cap. And on the image intensifier screen, we can see that rod going in quite nicely. Now, apple corer. So a little central hole, and this end has got a very sharp cutting edge here. That's just purely going to cut the skin and fat so that we get down onto the end of our rod. So this is guiding us down. Okay, so there's the rod at the end. So there's a little protective cap being removed now.
And that cap was purely to protect the inside of this taper just here. Okay, so this is the rod that's going to be going back into her. There is an it's got a little pin that's going to guide us to where we actually insert it. You can see a little hole next to the other one. That's going to where this locking pin is going to go into. All right, so we're nice and dry in there, so let's see if we can line this up, which we can. Mallet, thanks. So that's already Morse tapered home, so that's given us a mechanical lock. And the next thing is I want that screw that locks it. All right, so here's the locking screw that just reinforces it, so we'll also lock home and make sure this thing has no chance of coming loose. So we just add this extra locking device which will go down here. Screwdriver, thanks. Okay. So that's ultimately what she's going to have protruding through the skin as the main part. The skin will actually seal up onto that quite nicely, and because it's got this sort of grit bastard or rough coating, tissue actually likes grabbing onto rough surfaces rather than smooth surfaces. So it just sort of grows in on it. And that's really the end of stage 2.
In a few days, Professor Woodgate will get Shirley to stand. They will attach the new computerised leg and Shirley will try to walk normally for the first time in 4 years.